Celiac disease is a genetic autoimmune disease that is triggered by the protein gluten. When somebody who has celiac disease eats something with gluten in it, their immune system attacks their own small intestine. In the small intestine, there are these small finger-like folds of tissue called villi. Villi are essential for absorbing the nutrients in food, such as fat, calcium, iron, and folate. And if they're damaged, a person can become malnourished, among other things. So thousands of years ago, humans were hunter-gatherers, and their digestive and immune systems knew how to handle the food that they put into themselves. Then they learned how to farm, and these new foods caused some problems. Not every person was able to adapt to the diet, and many autoimmune diseases, including celiac disease, came into existence. Then in 250 AD, Arctaeus of Cappadocia accurately described celiac disease in his writings. He called it coliaco, or in English, the celiac affliction. In 1856, Francis Adams translated Arctaeus' writings from Greek to English. Then in 1888, Samuel Gee presented clinical records that supported Arctaeus' writings. Samuel Gee is the one given credit for finding celiac disease. In 1952, Dutch physician William Carroll Dyke discovered that the agent that triggers celiac disease is the protein gluten. 1 in every 133 Americans has celiac disease. That's about 1% of the population. It's estimated that 1 in every 100 people worldwide has celiac disease. It is also estimated that 83% of Americans who have celiac disease are undiagnosed or misdiagnosed with something different. Celiac is a hereditary disease that can be activated at any age. Stressful events such as surgery, pregnancy, childbirth, viral infection, and extreme emotional issues can cause the disease to become active. Celiac disease can be diagnosed using blood tests and intestinal biopsies. In the blood test, doctors are searching for high levels of autoantibodies. They're proteins that react against the body's cells and tissue. Intestinal biopsies remove a small piece of tissue from the small intestine to be examined. This is done by inserting a tube into the mouth of the patient and stringing it through their body until it makes it to their small intestine. Scientists also suggest that people who have close family members who have celiac disease get themselves screened for it because there's a chance they might have it too. Some symptoms, both short-term and long-term, of untreated celiac disease are abdominal pain, anemia, bloating, delayed growth, depression, diarrhea, constipation, severe skin rashes, dental defect, fatigue, gas, infertility, joint pain, mouth sores, vomiting, migraines, numbness in legs, osteoporosis, weight loss, irritability, malnutrition, arthritis, seizures, missed periods, miscarriage, liver disease, and intestinal cancers. There are so many possible symptoms because every person is different. There is no cure for celiac disease, and at the moment the only treatment that works is a 100% gluten-free diet. This means no wheat, rye, or barley. The food market and restaurants are getting better at providing gluten-free foods. If you have celiac disease and you're not sure whether or not something has gluten, read the label or ask your server. It's a completely new way of eating, but it is doable, and it's important to keep a positive attitude. The National Institute of Diabetes, Digestive and Kidney Diseases is currently researching celiac disease. They're working on more options of ways to diagnose it, and they're working on drugs that'll hopefully lead to a cure. That's it for this week, guys. Check out the links below to learn more about celiac disease and to donate, and I will be back next week with 2 more awareness videos. Bye, guys.